Hi, this is Tristan Moore, a volunteer with the International Autoimmune Arthritis Movement, presenting the topic of autoimmune arthritis and dental health. The purpose of this presentation is to provide a general overview of dental-specific challenges and solutions as it relates to autoimmune arthritis patients who are dealing with one or more autoimmune arthritis diseases. I did want to take a moment to mention that I personally wanted to present this topic because so many of us in the autoimmune arthritis community are affected by dental health care issues, but it's not something that's frequently talked about. The goal of my presentation is to bring awareness to this important topic in hopes that other patients struggling with autoimmune arthritis understand that autoimmune arthritis can, in fact, impact dental health and are empowered to recognize and address those problems ahead of time. Disclaimer, because our lawyers asked us to. Please be aware that I'm a patient and volunteer advocate and not a healthcare professional. The World Autoimmune Arthritis Day presentation is designed to provide accurate and authoritative information from a patient's perspective. Oops. By giving you this information, we are not giving any form of advice or recommendation, and we do not intend you to rely upon it when making or refraining from making any decision. The information provided in this presentation is of a general nature, and it is not intended to take the place of a physician's advice. It is vital that persons diagnosed with or suspected of having an autoimmune disease consult with their physician or the appropriate division at a major teaching hospital to assure proper evaluation, treatment, and interpretation of information contained on this site. Okay, so now we move on to the good stuff. What is autoimmune arthritis? Autoimmune arthritis was defined by IAEM and a rheumatology board as chronic systemic inflammatory autoimmune diseases primarily affecting the joints. Autoimmune diseases currently classified as autoimmune arthritis diseases are listed on this screen. Most of you by this point should already be aware and have probably seen these in other slideshows. These diseases are caused by a malfunctioning immune system. While joint involvement is a primary factor because they are systemic or whole body, they affect other connective tissue organs in various parts of the body. One of them just happens to be, or can be, your dental or oral health. So how can autoimmune diseases affect your dental health? Autoimmune diseases and the side effects of the medicines used to treat them bring increased risks of fungal infections, increased plaque and tartar leading to tooth decay and gum disease, increased risk of oral and dental infections, oral ulcers or lesions. Oral ulcers, by the way, can appear on the lips, tongue, roof of the mouth, inside of the cheeks, and on the gums. If oral ulcers are found, it is recommended that you let your rheumatologist know that you have them, as some of the autoimmune arthritis diseases, ulcers are a sign of active disease. Joint involvement in the jaw may cause problems with bite. Some autoimmune arthritis disease processes can cause or encourage problems like swallowing difficulties. And of course, joint problems in the hands may make it difficult to brush and floss properly, putting you at higher risk for dental and gum disease. One of some of the symptoms to look out for, which may signal an oral health problem. Dry mouth is the most commonly seen in Sjogren's, but can be seen in all of the autoimmune arthritis diseases, either as a direct result of the disease or a side effect of many of the medications. Saliva that seems thick and stringy. Some patients with Sjogren's have mentioned to me before that the first symptom they noticed was that they were waking up in the morning with thick and stringy saliva. Just, note that that's not, that there's other causes for that, not just Sjogren's. With that said, sometimes it is important to note that dry mouth, while it sounds like it's not or cannot be a severe issue, dry mouth can really make you more susceptible to dental caries and oral infections. Sores or split skin at the corners of your mouth, cracked lips, difficulty speaking and swallowing, sore throat, discolored teeth, cracked teeth, teeth with holes or obvious cavities in them, dental abscesses or infections. Sometimes a painful tooth is a sign of a dental abscess. An altered sense of taste and difficulty swallowing. sometimes difficulty with speech. If you have any of the above signs or symptoms of common oral health problems typical in patients with autoimmune arthritis, it is recommended that you have a thorough clinical exam by a qualified dentist. It is highly recommended that you clearly communicate to your dentist that you have an autoimmune arthritis disease and bring a list of your medications to your dental appointment. This just lets them know that you do have a systemic illness so that they know some of the things to look for in your mouth that could affect your treatment plan. Let's see, I'm missing a slide here. Okay. What are some of the complications of not getting oral health care problems treated? This is kind of important because it kind of brings home why it's important to pay attention to your dental health. Complications associated with untreated oral health complications are difficulties in chewing, swallowing, tasting, or speaking. This results in poor diet, malnutrition, and decreased social interaction. Oral discomfort, increased oral infections, and inflammation of something called the oral mucosa, which is just the inside lining tissues in your mouth. Patients are at increased risk of developing dental caries. We discussed that a few minutes ago. Some of the treatments for those are very expensive and include root canals, extractions, dentures, gum diseases, etc. Some of those disease processes are just best prevented, as the treatment can be painful and very expensive. Serious infections that can lead to tooth loss, and probably don't need to tell this to most of y'all, but some blood infections are not good in autoimmune arthritis patients, especially those that are immunocompromised because they're taking immune suppressants. When to see the dentist, routine checkups. Industry standard for healthy individuals is to visit the dentist at least once a year. Patients with systemic illnesses are generally recommended to have a dental checkup at least once every 6 months. If you have known an existing oral health disease process, it is generally advised to visit the dentist every 3 months or until your treatment is completed and the dental disease is under control. This is just kind of trivia, but did you know that 90% of systemic diseases have oral manifestations? A lot of those manifestations I read off to you earlier. 90%, that's a pretty big number. Approximately 95% of lupus patients suffer from some form of oral involvement. So if you have lupus, that's almost all of us. I'm not going to read off all of these because I made it available on the slide. But a big question that I get often is, what kind of dentist do I see? Well, there's multiple dentists. I listed them on the slide for convenience. Well, you can download the slideshow also from the resources section. That way you can refer to this list if you like. You will generally want to see or start with a general dentist who can refer you to a specialist if needed. I generally recommend, or my experiences from my own personal journey with the dental side effects of autoimmune arthritis as a younger person, is that children should see pediatric dentists. There's multiple reasons for that. Not only are they specialized and trained in dealing with childhood-specific related dental processes, but also pediatric dentists can help prevent dental fear with children. They're able to work more with them on their level. Let's see. So preparing for a trip to the dentist. Just let your rheumatologist know that you're going to the dentist and ask if there are special considerations you need to consider before treatment. Some patients need to take something called prophylactic antibiotics before having treatment. Some of them don't. There's been time periods that I've needed to take them before going to the dentist, but time periods I haven't. Just let your rheumatologist or any other specialist, if you're a cardiac patient also, obviously you just let your doctors know, hey, I'm going to the dentist, what special precautions do I need to take? If you do not currently have a dentist established, get a list of recommended dentists from your rheumatologist. He or she may have a list of dentists in your area that he or she may already be aware of that has treatment experience or education in understanding autoimmune diseases. Make sure your dental health care provider is aware that you have an autoimmune arthritis disease and what medications you are taking. I always highly recommend when patients walk into the dentist office or any healthcare office to have a list of your medications and then, of course, what your diagnoses are. That way they know ahead of time and everybody's on the same page as far as what medications you're taking to prevent sometimes dangerous medication interactions. Write down any questions you have for your dentist ahead of time. Before leaving the dentist office, ask what you can do to aggressively manage and prevent dental health care problems related to your condition. At this point, I'd like to recommend that, especially if you deal with dental fear or a lot of fears of the unknown, and sometimes it's considered taboo, but get out on the internet and find other patients for moral support or to ask questions. If someone's already been down the road that you're about to travel, it sometimes helps when you guys can share knowledge. That's especially useful if you're prone to dental fear. Obviously, be careful what you read on the internet, and don't make decisions until you speak to a healthcare provider. I struggled with dental anxiety for a long time and overcame that anxiety in part thanks to significant resources and moral support I was able to locate on the internet. What can you do to prevent dental and oral health problems? Well, this is obviously the key because prevention is preferred over the alternative. Making critical lifestyle choices to support the healthiest oral environment possible is important for autoimmune arthritis patients. To minimize cavities and gum disease, etc., avoid smoking. You probably shouldn't be smoking anyways. Sugary candies and sodas. Avoid citrus fruit juices in between meals if possible, or any drinks loaded with sugars. In between meals, just stick with water. Brush your teeth for at least 2 minutes in the morning and at night with a fluoride-based toothpaste or the toothpaste recommended by your dental care provider. Floss your teeth at least twice a day. Include other healthcare treatment regimens as recommended by your dental health care provider. For kids, I wanted to recommend there's toothbrushes over the counter. I use them with my kid. There's a little button on them that you can press and it lights up and it automatically runs and stays lit for 2 minutes. That way the kids always know it's been 2 minutes and they're done brushing their teeth. Report any suspected oral complications to your dental health care provider or your doctor promptly. And see your chosen dental care provider for a checkup once every 3 to 4 months, at minimum every 6 months, especially if you have risks or existing dental health related problems. I thought this was interesting. In June 2001, the Journal of Periodontology reported on an Australian study involving 130 people. 65 had RA, and those with RA were twice as likely to have periodontal disease with moderate to severe jawbone loss than those without RA. The rheumatoid group had lost 11.6 missing teeth on average compared to 6.7 missing teeth in the non-rheumatoid group. I have kind of found that to be kind of a common problem, especially in the RA group, is dental health sometimes doesn't. I think sometimes it gets a little bit of a backseat to more serious treatment needs. Let's see. I highly recommend and encourage additional education on basics on basics of oral and dental health care to help autoimmune patients prevent long-term, painful, and expensive and serious problems. One of the best people I have found, at least on my journey on getting extensive dental care treatment is my dental hygienist. They will oftentimes kind of review your situation and give you extra tips that will help you stay ahead of your complications of your autoimmune arthritis as it affects your dental health. Especially if you're dealing with joint problems that make it difficult for you to get in the back of your mouth or floss. Sometimes the dental hygienists have little hacks to help you get around that so you don't miss areas in your dental cleanings. I provided some resources and links to sites we found useful in learning more, and always highly recommend, again, your dental hygienist for further resources. All these links on here, don't worry about writing them down. I have Tiffany put this in the resources section of the World Autoimmune Arthritis Day site so that y'all can download it and click the links. I also included a couple of links that I found that I thought was interesting for kids. They can go learn about the teeth and dentists, etc., the dental museum. I found some articles that's specific to autoimmune arthritis diseases and dental health. This one on the Lupus Dental Care Guide is awesome, and I think it could be applied to other autoimmune arthritis diseases as well, not just lupus. So even if you don't have lupus, if you have one of the other autoimmune arthritis diseases, check the Lupus Dental Care Guide out, because I think you may find it very useful. Here's even more information. Autoimmune arthritis specific and dental health. The last one, Children's Oral Health and Advice from Colgate. I'm not sponsoring the Colgate or pushing Colgate, but the Colgate site had a lot of interesting games and fun stuff that's kid specific, that parents out there with kids that need to go to the dentist or need dental health care can get them involved in that. Thank you very much for tuning in. I hope that this presentation has been useful and that everybody has a pleasant evening. Thank you.